She makes good eye contact. She has friends. She makes good grades. But she's also overwhelmed and exhausted and trying really hard to fit in. Let's talk about the signs of autism in girls that often go unnoticed. Welcome back. I'm Dr. James Thatcher. In part one of this series, we covered some different reasons on why girls on the autism spectrum often get overlooked. And today, we're going to go into 3 more hidden signs that you can look for as a parent, caregiver, teacher, what have you. And if you stay to the end, I'm going to go into a bonus one that I feel often gets missed. Hidden sign number 4 is internalized meltdowns. Unlike the outburst that you may associate with autism, girls often tend to implode. And what this can often look like is girls can complain of headaches or stomach aches, emotional shutdowns, social withdrawal, panic attacks. I worked with one person a while back that would often have headaches in the middle of the day. And think about what happens in the middle of the day at school, right? There's lunch hour, there's recess. That's when these headaches would strike. And in doing that, when she had these headaches, she could go to the nurse's office. And that got her out of going to the cafeteria outside at recess, where all these confusing social interactions were going on and all of this overwhelming sensory noise was happening. Hidden sign number 5 is special interests that fly under the radar. Girls often develop these very deep and passionate interests that often get seen as normal, to where they might be really passionate about animals, Harry Potter, K-pop, or even drawing. I had one patient who was very interested in drawing, and they drew the same character 128 times. It was a lot. And it was the same character, but it was little variations each time, to where maybe they had a different dress on or a different pair of glasses, or they were in a different setting. They had a whole binder of this same character, just with different things on them. Hidden sign number 6 is difficulty with social nuance. They may know the different social cues and rules to use, but they still miss the mark. Understanding sarcasm, knowing when to join a group, or engaging in a back and forth conversation can be incredibly difficult for them. I can't tell you how many times in the middle of a therapy or an evaluation that I'll share something about myself. And I do that on purpose to see if they can engage in a back and forth conversation. And some of the times, especially girls on the spectrum, they don't. Or I'll also hear stories about how, while at school, they don't speak up during group activities. And the reason behind both of these scenarios is that they think that it's rude. They don't want to speak up unless somebody speaks to them first. That's the rule that they're going by. But they're missing the mark. They're not quite understanding that it's okay to join a group conversation. It's okay to ask follow-up questions if someone is giving you a pretty obvious lead. So now we've made it to that bonus one that I want to talk about that I feel gets often missed. But I've got a little bit more in this video, and one thing that I just thought of is I want to go into the eye contact myth, and I'll go into that here in just a minute. But the bonus hidden sign that I see get missed quite a bit is that girls are often perfectionists. These girls are often rule followers and high achievers. But this motivation often isn't coming from their confidence. Rather, it's coming from anxiety. So some different things to look for in this sign is meltdowns over small mistakes, or a huge fear of disappointing other people, or even good girl behavior, which tends to mask how they're actually feeling inside. And this can look like, hey, everything's fine. I'm doing my job. My grades are doing well. But inside, they're really anxious. I worked with a girl one time to where she never got in trouble, she made straight A's, and she had a decent amount of friends. But every night when she would get home from school, she would cry because she was so overwhelmed and she was so worried that she was going to make a mistake, that she was going to make someone disappointed. This is not a way for a child to live. This isn't a way for anyone to live. So now I want to debunk that eye contact myth. Yes, girls with autism can sometimes make good and appropriate, or what's called well-modulated eye contact, but that doesn't rule out that they have autism. I can't tell you how many times that I've worked with a female on the spectrum, and years before they tried to get the help, they tried to talk to a clinician or talk to their teacher or a counselor at school, and they were told, well, you can't be on the spectrum because you're making good eye contact with me. Making good eye contact doesn't rule out that you have autism. What to look for is how hard are they working in order to fit in? Is this coming naturally to them? Is this something that they've had to teach themselves? And eye contact is just one of hundreds of symptoms. And to look at just one and rule everything else out, that's inappropriate and it hurts the patient. So now let's talk about why early identification matters. When girls are missed, when they're not seen as having autism, when this is overlooked, they can often develop anxiety and depression. They feel like something is wrong with them, when in fact it's not. And they can get burnt out from all the years of masking. And I just want to say, getting an evaluation for autism isn't about labeling. It's about getting your daughter, your patient, your student, the support, the language, and the validation that they need. And if any of these signs sound familiar, trust your gut. Seek out a neurodiversity affirming evaluation. And if you like this video, please share it, comment, subscribe, and also share this video with someone that you feel might be looking for answers. Let's help girls be seen for who they really are.